up on our program is On-Site for Seniors, Telehealth for the Homebound, and Barbara Mueller.
Over the last few weeks, I've had the honor of spending time with Linda Arnold, who is the Executive Director and Wound Care Specialist for On-Site for Seniors. In a perfect world, she would be here to share her passion instead of you getting me. Linda said, On-Site strives to meet the needs of homebound patients in their places of residence, providing the care, compassion, and connections needing for them to live life to the fullest. That's her intention, that the patients would live life to their fullest. I love that. And when she meets the patient for the first time, she tries to meet them where they are in their lives, wanting to take the next step with them. For her, the tragedy is when On-Site doesn't get to help people, like 86-year-old Dorothy. Dorothy was a very proud, independent woman who insisted on living alone despite health issues that were causing her to develop terrible sores on her legs. One afternoon, on her way to immediate care for treatment, Dorothy fell on the ice and fractured her hip, and from that moment on, she wasn't independent anymore. So imagine that you could get exceptional medical care with no trips to town, no long hours waiting in the emergency room, just skillful care in the safety of your own home. On-Site for Seniors does this right now. This non-for-profit takes both Medicare and Medicaid, turns no one away for financial reasons, and while providing services to the elderly and the homebound. And they do it by making house calls. Using 4 primary care providers and 1 wound care nurse, they have been able to support a client list of 650 people, which translates into them seeing over 7,000 patients last year, 7,000 patient visits. Sadly, they have a long waiting list with people actually dying before they can get help. Last year, On-Site for Seniors came to WGA with a proposal that might have changed Dorothy's story, telehealth. They are again giving us the opportunity to make telehealth a reality in our community. They have chosen a new integrated package of proprietary software and hardware provided by the VC Corporation. The package has been tested by many institutions, including the National Institute for Health, Stanford University, International SOS, demonstrating service in remote locations, and even NASA in space. This software is HIPAA compliant and solves their bandwidth problem in rural communities. It uses cutting-edge telemedical devices that include ultrasound, EKG, Dopplers, stethoscopes, tools to check eyes, ears, nose, and throat, and monitor wounds, all through clear streaming video using remote camera control. The beauty of this package is that more instruments can be added as they're needed. Software is automatically updated and allows an unlimited number of patient access points and remote visits. That means that the primary care provider can be in her office and connect to any remote location where there is an iPad or a smartphone. She can do medical evaluations using the devices, assess a home environment, or instruct the caregiver on how to manage a wound. While this is happening, another home care nurse can be traveling miles away to another location to set up and get ready to connect to the primary care provider who is still in her office with the next patient. There is even a free app that a patient can download if they have their own smartphone or iPad. On-Site for Seniors feels that they can conservatively increase their client load from 650 people to 800 clients immediately, which would mean they would be able to have over 10,000 patient encounters a year. 10,000. Studies show that when you're using telehealth, there is a 50% reduction in ER visits and hospitalization. So in dollars, what does that mean? Telehealth costs $3,200 a year a patient. Normal care, $12,000. In people terms, it means less surgery and fewer amputations. The results are also dramatic using telehealth with heart and diabetes patients. With VC Telehealth Kit, they can immediately address many issues, including wound care, hypertension, diabetes, heart and memory issues. The HD video streaming allows the primary care provider to observe behavior of memory loss patients not in a stressful situation of their office, but in their home environment. It detects when a client is living at risk, they have been seeing over and over again and cannot figure why she keeps swallowing. And when she's at home, they see she has 20 cats. They see a chair that is rubbing the wounds on the back of a patient's legs. This patient has been coming to them for a long time, and they have been seeing these wounds develop over and over again, and they don't know why. When they do a home assessment through the telehealth, they are able to see the problem. A middle-of-the-night house call can happen with an iPad or a smartphone, saving the confusion and fear that a trip to the emergency room can cause. Or the provider, without being on site, can make a diagnosis that an ambulance should be called immediately. Using the additional iPads that they're also going to purchase through this grant, they can leave an iPad with a patient who does not have the funds to buy one but needs closer monitoring. They will be able to teleconference with a patient and another physician using real-time video, getting a second opinion right away. When was the last time that ever happened? There are great challenges in the healthcare system, especially if you are older or living at the poverty level. Fewer providers are accepting new Medicare and Medicaid patients. And yet, on-site for seniors, patient load pay mainly for Medicare and Medicaid. And this not-for-profit is looking for ways to provide more scheduled or urgent care visits without the patient leaving their home. This significant savings in patient care by using telehealth can amount to hundreds of thousands of dollars. But more important to Linda Arno, On-Site for Seniors understands when they meet a client, they are walking into their stories. And an open wound is not often as damaging as a wounded heart. With the increased connections they can make through telehealth, they can reduce fear, instill hope, provide encouragement, and offer peace. Having a VC telehealth kit keeps a 50-year-old man debilitated by the effects of diabetes out of assisted living. It would have saved Dorothy from having to be outside on a frigid, icy day, and it might save you from a journey into an emergency room for care that could have been provided at home. All of this is because of a mobile clinic in a box and an excellent, compassionate provider committed to healing who is on site because of the VC telehealth kit. You can turn the loss of a grant last year into a major win for on-site for seniors and our community by voting on-site as one of your grant choices tonight. Thank you.